The 30th sitting of the Tobago House of Assembly Legislature will be held this Thursday, the 21st of October 2019. The motion will be moved by Councillor Dr. Agatha Carrington, who is requesting support from the House for the decentralization initiatives which have been implemented to improve the delivery of effective healthcare on the island. As presiding officer, I invite you to join us for another debate on your future, whether in chambers, Tobago Channel 5, or live on the Assembly Legislature's Facebook and YouTube platforms. Let me also take this opportunity to extend greetings on the upcoming Diwali celebrations and soon thereafter Remembrance Day. I look forward to your presence on Thursday.
Please note the following safety rules. Should there be any reason for you to evacuate the chamber, use either of the two exit doors. Those who use the door located next to the public gallery are advised to proceed through the lobby to the front doors, down the main staircase to the muster point at James.
That we may wisely take counsel together and come to such decisions as shall promote your glory and the well-being of all our citizens in this our land, so that peace and happiness, truth and justice may be enjoyed by all people. Grant this for the sake of Jesus Christ our Lord. Amen. Oath of allegiance of a new member. Announcements by presiding officer. The Chief Secretary and Secretary of Agriculture have sent apologies for their absences from today's sitting. Members, the Minister of Finance in his recent budget statement 2019 to 2020 highlighted the government's priority to placing the environment at the center of the national development. As he stated, and I quote, "In order to encourage behavioral change, I propose to terminate the use of plastic water bottles in government offices and substitute them with coolers with filters. This measure will take effect on January 1st, 2020. Previously, a motion was also carried in this House in 2017, committing to becoming more environmentally sensitive, and following by my agreement for the Assembly Legislature to partner with the Green Army in having members around this table sign the Green Book in June of 2019 with a personal commitment towards a green Trinidad and Tobago. I am therefore pleased to formally advise that as of today's sitting, the legislature has implemented the elimination of single-use water bottles in the House and has replaced them with a water cooler at the entrance for your convenience. I hope that you received your sleeved glasses on entering, which you will be expected to use for refills as you so desire. Additionally, in a short while, the Assembly Legislature will become a paperless house, where laptops currently being procured will be distributed and therefore your order papers and other items as such will be online. The website has already been activated and available to the public, and Hansard records are also being placed there. On my own behalf and that of the members of this honorable house, I wish to extend deepest condolences to the member for Palatuvia Lansome Speyside, Assemblyman Fali Augustine, on the recent passing of his mother. I pray that God gives him the strength to carry on during this time of his grief and in his future activities. And I ask the minority leader to please extend those condolences on our behalf. Lastly, let me take the opportunity to welcome all of those in the public gallery and viewing from elsewhere for the 30th sitting of the House. We are pleased to have you with us today. Thank you.
Assembly bills sent back from Cabinet. Assembly laws brought back from Parliament. Petitions, papers.
Assemblyman Shomari Hector. I'm sorry, Secretary of Finance and the Economy.
Thank you, Madam Presiding Officer. I have the privilege today of tabling the Tobago House of Assembly's monthly budget report as at the end of August 2019. But Madam Presiding Officer, before I take my seat, let me join with you in extending condolences to Assemblyman Fali Augustine, member for Palatuvia, Lansome and Speyside, on the passing of his mom. I remember it was just over 1 year ago when you had to extend condolences to me as well on the passing of my mom just before the presentation of the budget. And I had to present the budget on the Monday and debate the Thursday and attend a burial on the Friday. So I can empathize with the Assemblyman during his time of bereavement, and from this side of the House we extend condolences to the Assemblyman in this regard. Thank you.
Presentation of reports from Dispute Resolution Commission, Select Committees, Code of Conduct,
Assistant Secretary in the Division of Community Development, Enterprise Development and Labor.
Thank you, Madam Presiding Officer. I have the honor to present the following report as listed in the supplemental order paper in my name, namely the report of the Standing Order Committee for the period 2017-2021 session of the Tobago House of Assembly for the consideration of this House. Like my colleague, before I take my seat, permit me to lend my voice in expressions of sentiments to the passing of my Assembly colleague, Minority Member Fali Augustine, the passing of his mother. I cannot say from personal experience that I can identify with the depth of agony, bereavement, and sorrow associated with such a loss, but I do know, as is the case of the words made known by the great philosopher and poet, that any man's death diminishes me. And in respect of that, I wish to put on record my sincerest condolences and to have the member opposite know that, like my colleague and like this administration of the Tobago House of Assembly, we stand with him during this season of great pain and bereavement. Thank you.
Leader of Assembly Business.
Thank you, Madam Presiding Officer. I have the privilege to lay before this Honorable House the report of the Code of Conduct Committee for the 2017 to 2021 session of the Tobago House of Assembly. Madam President, before this August House, Madam Presiding Officer, I would like to associate myself with your comments and the comments of my colleagues in expressing sentiments of condolences to the Minority Assemblyman at this point in time. As it is during this period of loss, I would have spoken to him personally, and we'll continue to lend whatever support we can during this time of pain and bereavement. At this time, I'd also like to extend birthday wishes to the Honorable Prime Minister of the Republic of Trinidad and Tobago as he celebrates his 70th birthday, quite a milestone. Thank you, Madam Presiding Officer.
I would just like to add that all of those reports can be accessed electronically and on the website.
Questions to secretaries? Questions for oral answer?
Question number 69 by the Minority Councillor.
Question number 69 to the Secretary of Infrastructure, Quarries and the Environment and Leader of Assembly Business. The Mill Shelf project was launched in December 2013, was originally estimated to cost $143 million. Please indicate the total cost of the project at the end of December 2017. Please outline the monthly lease cost and the total amount paid as at April 20th, 2019. Outline with details what construction rehabilitation works and their associated costs were completed between January 2018 and April 2019 under the purview of the THA. And finally, outline with details any ongoing works, including the type of works, the contractor, the estimated cost at completion, and the estimated completion dates.
Secretary of Infrastructure, Quarries and the Environment.
Thank you, Madam Presiding Officer. I'm indeed pleased to be able to provide a response to the question as tabled by the Minority Councillor. It may serve for the edification of the Councillor and for this August House that the Mill Shelf project, though the Department of Licensing now resides there, is one that does not fall under the complete auspices of the Division of Infrastructure, Quarries and the Environment. However, we would have gathered the necessary data, and I hope that this will suffice the question. As regards A, Madam Presiding Officer, I'm pleased to provide, or please inform this House that the Assembly entered into bolt, build, operate, lease, transfer arrangement for the construction of an administrative building to house the Division of Food Production, Forestry and Fisheries and the Licensing Department of the Division of Infrastructure, Quarries and the Environment in a modern, environmentally safe and OSH-compliant facility of approximately 87,800 square feet. As indicated at the groundbreaking ceremony in 2013, under this bolt arrangement, the developer finances and constructs the administrative complex and leases it to the client, in this case the Assembly, for a predetermined cost upon its availability. And at the end of the 20-year lease period, ownership of this asset is then transferred to the client. again, the Assembly. The approximately $143 million investment, as pointed out by the Minority Councillor, was provided by the project lead developer, and it involved no cash outlay, initial cash outlay by the Assembly, as it is repaid on a lease-to-own basis. Madam Presiding Officer, for the purposes of ensuring that the employees and the public who access the services of the Department of Licensing were able to be in a safe environment, a comfortable environment, an OSH compliant and environmentally friendly space, the EIDCOT was engaged by the Office of the Chief Secretary to undertake project management and outfitting of the Milshiv building in total for use by the two divisions. Again, the Division of Food Production, Forestry and Fisheries, and the Licensing Department. As it regards the Licensing Department, this was phase one of the project, and this was outfitting a portion of the southeast ground floor of the Milshiv building to accommodate the Licensing Department. Phase one was completed in December 2017 at a cost of $6,536,118.55 VAT inclusive. As it regards B, the monthly lease cost and the total amount paid as of April 30th, 2019, as I indicated before, Madam Presiding Officer, though this does not fall under the auspices of the Division of Infrastructure, Quarries and the Environment, and for the edification of the Council and this Honourable House, it falls under the auspices of the capable Deputy Chief Secretary and Secretary of Finance, and the Division of Finance and the Economy. The quarterly lease payments, VAT inclusive, is $4,044,234.18. The total lease payments, VAT inclusive, as of April 30th, 2019, is $52,575,044.34. In terms of the details of the construction or rehabilitation works, the associated costs in brackets, and that were completed between January 2018 and April 2019 under the purview of the Tobago House of Assembly. Madam Presiding Officer, this accounted for phase two of the engagement under EIDCOT. The outfitting of the remaining areas of the three-story building for occupation by the Division of Food Production, Forestry and Fisheries during the period January 2018 to April 2019, construction and repair works and outfitting works were undertaken. There were also maintenance works and repairs to the MEP systems, which include, of course, the air conditioning system, the electrical generator infrastructure, fire suppression, plumbing, sprinkler system, and the elevator during the period. Repair works to portions of the roof were also done out of an abundance of caution following severe weather on a couple occasions. The cost of works completed during the period January 2018 and April 2019 amounted to $19,905,275. VAT inclusive. The details of the work done: 1. Demolition and alteration of the floor layout, third floor. 2. Superstructure plumbing installation. 3. Superstructure heating, ventilation, and air conditioning installation. 4. Superstructure electrical installation. 5. Superstructure fire alarm installation. 6. Superstructure security CCTV installation. 7. Minor roof repairs. 8. Joinery works. 9. Painting of internal walls. 10. Wall, floor, and ceiling finishes. 11. Ceiling works. 12. Installation of showers and tiling works to bathrooms. 13. Masonry works. 14. Installation of additional emergency doors. 15. Installation of emergency steel staircase. 16. Generator servicing. 17. Repairs to atrium and window glazing. 18. Installation of emergency ramp access to ground floor. 19. Elevator servicing. 20. installation of blinds to second floor. 21, installation of mat wells. 22, installation of carpets in the second floor executive offices. 23, servicing of low voltage rooms. 24, tinting of atrium glazing. 25, installation of generator communication software. 26, repainting of northern external wall in the area of the newly installed emergency staircase. 27, sprinkler works. 28, additional electrical works. 29, procurement and installation of all furniture, fixtures, and finishings. Outline with details any ongoing works, including the type of works, the contractor, the estimated cost at completion, and the estimated completion dates. Madam Presiding Officer, practical completion of the project was attained in April 2019, whilst the official practical completion certificate was issued in June 2019. However, final items of work are in progress and are detailed below. 1, installation of stainless steel handrails. 2, installation of emergency door locks. 3, installation of blinds to first and second floors. 4, high voltage testing. 5, installation of staircase rubber tiles. 6, replacement of glass windows on the ground floor. 7, roof repairs in the area of the AC units. 8, cutting of master keys. 9, installation of 2 additional emergency doors to additional offices. 10, servicing of the HVAC system. 11, installation of wheel vanguards for car park. 12, installation of signage. 13, maintenance and servicing works to potable water system. 14, maintenance and servicing works to sewer system. The main contractors for provision of the services through Milshire were contracted, as said before, by EADCOT. Practical completion of the project was attained 2019, while the official practical completion certificate was issued in June 2019. Presently, work is being carried out by the 4 contractors as nominated through the procurement process under EADCOT, and they are responsible for the networking, telecommunication services, security access controls and CCTV, and general outfitting of the building. These include the telecommunication services of Trinidad and Tobago, Rupert Antoine, the independent consultant, facilities outfitting, Bino Row Wilshire Partnership, consultants, Bewell and Company Limited, the main outfitting contractor. As of October 21st, 2019, the completed works total $33,796,734.53, VAT inclusive. The project is estimated to be completed in November 2019. Thank you, Madam Presiding Officer.
Request for leave to move the adjournment of the Assembly on definite matters of urgent public importance. Statements by secretaries or assistant secretaries. Personal explanations. Introduction of bills. Motions relating to the business or sitting of the Assembly and moved by a secretary or an assistant secretary. Public business. Executive Council business. Motion.
Secretary of Health, Wellness and Family Development.
Thank you very much. I too want to join my colleagues on this side in extending condolences to Assemblyman Fali Augustine on the crossing over of his mother. I also want to thank the staff of the Scarborough General Hospital who were privileged to provide care to her in her last moments. Madam Presiding Officer, and my colleagues on this side and those in the gallery, the motion that I will table reads as follows. Whereas one of the fundamental pillars upon which any society develops is an effective healthcare system, and whereas this administration, through the Division of Health, Wellness and Family Development, has been leveraging the decentralization of and improvement in healthcare in Tobago, be it resolved that this House takes note of the initiatives that have been implemented in improving the delivery of effective healthcare on the island. And be it further resolved that this House encourages the Tobago population to access these newly decentralized services and continue to participate in community engagement exercises of the division. Madam Presiding Officer, in coming into office, this administration pointed to those efforts we should embark on to enhance delivery and strengthen partnerships. And so today, my motion will be presented within the following framework. I'll present a context within which we have been seeking to do so, that is to enhance delivery. I'll point to the extent to which we have a well-functioning system. I'll point to those areas that have been leveraged to improve healthcare, and I'll point to those initiatives which we have delivered and those that are in progress. Madam Presiding Officer, a well-functioning health system is one that responds in a balanced way to the needs of our population and its expectations. More particularly, such a system will seek to improve the health status of the individuals, families, and communities. Such a system would provide equitable access and people-centered care. Such a system would defend the population against any threats to ill health. And such a system will protect people against the financial consequences of ill health. Madam Presiding Officer, as we embarked on our efforts to improve healthcare delivery, it was necessary that we realign and rebrand the division. The division now is termed and is named the Division of Health, Wellness and Family Development, with a focus on wellness and family. And therefore, building on the WHO building blocks, our intention is to continue to use those frames that have been tested and proven as we seek to do the work. And therefore, the frame that we'll be using would be one which would measure data and information, one which would look at our service delivery, one which will look at our medical products and technology, one which will look at healthcare financing, one which will look at leadership and governance. More importantly, though, we on this side need to understand or have understood that except we pay attention to quality, efficiency, acceptability, and equity, we will not be able to bring about the changes we want to see. And therefore, as we seek to provide care, and as we seek to provide the resources required, and as we ensure that we have good stewardship, today's motion will point to what has happened. Madam Presiding Officer, this administration, as I said earlier, in its outreach, sought to engage the community such that they will contribute to the planning process. And we have had 2 cycles of those sampling communities throughout Tobago. That was important for us because we needed to understand just what the community would require, in addition to looking at the data. And so before I go deeply into that situation, let me just say that for us as practitioners, we understand that much of what we do must be placed within a context. And therefore, this administration, in its effort to make the Tobago health service and health system the preferred destination for healthcare delivery, we have sought to examine the Sustainable Development Goals. May I say, in doing so, we have been focusing on Goal 3. Goal 3 speaks to good health and well-being. We have also been paying attention to our Vision 2030, Theme 1 that speaks to putting people first, where our health system and our health service will be delivering the highest standards of care, where people will be more empowered to exercise greater responsibility for their health. We know as well that if we have to do so, we have to look at our programs and projects. And so for those vulnerable groups, we have been looking at the extent to which our social programs are responsive to the needs of our population. We have also been looking at our Theme 2 in Vision 2030, where we are expected to and have been making efforts to provide good governance and service excellence. But more importantly, within the context of the NCD plan, Non-Communicable Diseases Plan of 2017-2021, we have been focusing on 4 main areas. Number 1, we're focusing on risk reduction and health promotion. We focus on integrating the healthcare delivery. We focus on surveillance, monitoring, and evaluation, and governance and advocacy. That's important because we want to be able to measure the extent to which we are impacting this population. And therefore, I will want to look at the first part of the motion, which firstly speaks to the second part, which firstly speaks to the areas that we said we will leverage. Let me just say that with the assistance of my ABLE team, we have been leveraging the decentralization of healthcare delivery. More importantly, we have sought to look at and focus on health promotion and disease prevention. We have also, in that regard, ensured that we look at our data such that we could be much more data-driven. And therefore, we have established NCD registries in our workplace, because we understand the importance of data. If we are to change the way we do business, it is important that we become much more evidence-based. And therefore, as we seek to respond to the needs of the population, and as we seek to promote decentralization of healthcare delivery, that became very important. May I say as well, in decentralizing the healthcare delivery, we in fact are moving decision-making and services from the center to the periphery. And so, when I speak to the initiatives, those will be made much clearer. Our primary care services is critical to the decentralization of services for population. And so the promotion of early screening and health education and those efforts, these were important and are important to what we do. So we continue to provide health education and early screening to address those concerns in our population. We have been maintaining these efforts because if we were to improve the lifestyles of our population, we believe that we would change the profile of the population of Tobago. And let me just share quickly in terms of some of the activities that has been happening. So in our primary care settings, our lifestyle clinics are very active, ensuring that those persons who require the improvement that we know that they're seeking, that happens. We provide for them nutrition education, we provide for them mental health awareness, we provide for them testing for their NCDs, and these are important. We also continue to provide to them extended hours of care in 3 primary care centers. That is important because for those persons who cannot access the services between the 8 to 4 hour, there are 3 centers that they can access that service, being Roxborough, Scarborough, and Canaan. We can do better, But at this time, these are the 3 areas that are providing that service. These initiatives were made possible following some of the discussions we have had with the community, and we have gone from Canaan to Charlottesville, sampling the population and trying to understand what exactly we should be doing for them. The other area that we continue to leverage, apart from decentralization and health promotion, we have been looking at upgrading our services. We have seen the areas that we need to look at, and I will point to those in the initiatives that we have delivered. More importantly, let me just point to another area that we have been leveraging, and that is improvement in healthcare delivery at the hospital. In doing so, we felt that we must look at our emergency room, and activities have been in place to improve that service. There is much more that we must do with respect to that. We've also been pursuing the extent to which our services could become much more effective, and therefore inpatient care is under review and our outpatient services as well. In the coming months, we are going to be looking at our hospital in terms of our health promotion initiatives, but that is yet to come. A big area that we have been working on, and it has been a struggle, it is with respect to our maintenance efforts, and that is ongoing, and we expect to see the kind of improvement that will be down to the benefit of our population. But as I continue on this discussion, may I say as well, as we leverage those areas, it means that we are giving focus to these areas because we want to ensure that we confront this challenge, that is the lifestyle diseases, and that we improve our infrastructure, that we do not have the infrastructure and the condition that most of our areas tend to have when we do not take care of them, and that we improve both primary and secondary level service so that it will impact the population in the long term. And therefore, we are not seeking or have not sought over the past years since 2017 to do a whole lot, but that we have sought to leverage 4 huge areas under health and wellness. And those are the areas that we are continuing to focus on, and these areas, the results will be presented on. Just to remind us that we are pointing to the areas that we are leveraging to improve healthcare in Tobago. And so let me just look at the improvement in healthcare delivery in primary care, just to share some of the data. And I'm saying this is not a perfect world, but we have been making bold efforts to do so. So if I'm to look at our lifestyle clinics, what we've been doing, 2017 as compared to 2018. So in 2017, we saw over 2,900 persons coming to our lifestyle clinics in 2017. By 2018, we have 3,600 persons coming to our lifestyle clinics. And my understanding that 2019, we have many more persons visiting this clinic. This clinic is one that we encourage in persons to exercise greater responsibility for their health. And this is a good uptake, we think, for us. With respect to our extended hours to which I just pointed, our 2018 figures are phenomenal because we're seeing upwards of 7,600 persons coming into our extended hours of service. But may I say, and which is important for us to note, only 3% of those are referred to our emergency room. With respect to our outpatient services, as most of us would know, if you are a patient of the hospital, your follow-up is done in the outpatient clinic. And therefore, we are seeing, just looking at 7 months of this year, over 23,000 persons have been provided with services at this. 23,000 visits have been made possible through our services. We continue to provide support such that those persons their health would improve and later on would go back to their homes and continue. With respect to accident and emergency, just looking from January to July, I did say that we have been trying to improve the wait time in terms of what is happening in our outpatient clinic, And looking from January to July on new visits, over 13,000. But we've had some revisits, over 5,200. Or admissions to hospitals, 793. I just want to look at an area that continues to challenge us as well as we seek to improve the care. Our imaging department has been a bit of challenge, but notwithstanding that, we've been able in the last year to provide over 27,000 examinations. And we will continue to improve this particular service to our population. It's important that the numbers be provided such that when we speak to the issues, we understand that we have been doing not too bad. Let me just look at another area that we provide support in our secondary care setting. In pathology, and oftentimes you may hear complaints with respect to not having various tests, but may I say, within the last year, just by way of mentioning some of the tests that people have been able to benefit from. Or renal profile, over 204,000 tests. Or liver profile, over 217 tests. Or lipid profile, over 33,000. And the list continues. So that while we have some challenges, we have studiously been able to improve services while recognizing the challenges and ensuring that the population is provided with support and care. Let me just also point to an area that I think that I need to engage in a little bit, because the area of research, which is one that has given rise to some of the improvements that we have been seeing. So whereas we're leveraging those 4 areas in health and wellness, we have been focusing on our research. And in our early days coming into office, we established a research ethics committee. We expanded the policy research and planning unit, ensuring that we are much more able to do the work. In the fullness of time, we will be properly equipping our staff to do much more. And through the efforts of the team that is now there, we've been able to collect data from most of our health centers for hypertension and diabetes. We felt that was important because we needed to know what is happening with our population, the profile of our population we are trying to look at. When we have been able to analyze that data, we would share that shortly, because much work has gone into that. But more than that, we've been relying on the collection of data for cancer patients by the Elizabeth Commoner Cancer Registry. And sometimes they do not come to us they don't come to us frequently. And what we have done is to have persons trained in cancer registration so that we now have skills on the island to do the data collection ourselves. We think it was important to build capacity in our staff so that we can do the work required of us. Let me just point to an area as well in terms of support for healthcare. Earlier, I spoke to the fact that the Scarborough General Hospital has been providing, trying to improve care. In circumstances where the care is not available, this administration has put in place a medical assistance review committee. That became necessary because when the service is not available in the public sector in Trinidad or Tobago, and this service has to be purchased on behalf of the client, we are able to assess the situation and provide the requisite funding. And to date, we have seen many persons benefiting from this service. In fact, in the last year, we've provided over $500,000 in assistance for persons requiring to do, whether it be interventions for the eyes, for the feet, whatever that we can't provide, it is provided through them. Let me just also say as well, because we have to build on what we have in place already, the training of our staff is important, and many of our staff have been able to benefit from training. And so the training of our nurses and soon the training of our physicians will be in place. So some nurses are being trained and the doctors are to be trained in specialized areas. Much of what we have been doing in the health sector has been a labor of love for many of our professionals, many of them. Many of them have been working very, very long hours in terms of some of these efforts. So let me just quickly point to a few areas. One, in terms of the public health department, they've been faced with many challenges, not having appropriate vehicles to do their work. And in the last year, we've been able to make the sacrifice with them to provide for them 10 new vehicles that were very much needed so that they can do their work. We thank them for their labor of love and sacrifice, and they're now better equipped to respond to the needs of our population. Let me just also point to another area as we seek to strengthen the service. Earlier, I spoke to the fact that we had to look at our registries and ensure that the data supports what we've been doing. We've been looking at our data in terms of strokes on this island, and therefore, whereas we know we have to provide for health promotion and disease prevention, many persons are already affected, and therefore, looking at the data, we've sought to launch, and this is in effect, our Stroke and Diabetes Center. This was important because we still have, in our setting, coming to us, an average of 14 strokes a month, and therefore, we have to provide services to those persons, in addition to what is provided at hospital. Apart from that, and because of the data as well, we've had to provide and respond to a need to have a foot and ankle service, and that is also available to the population. Again, the data has given rise to those decisions. Let me just also point to another area that a lot of times we do not speak about in terms of our services, and the area of mental health. And so our mental health and wellness efforts have been re-energized. We are seeking to respond much more to the needs of those who are mentally ill. And therefore, we have since launched our therapy service. The expectation is that we will see some improvement in the services we provide. We are trying to change the model that is now in place, such that we provide for them art therapy, music therapy. We're soon to build out their healing garden, allowing for the environment of care to be much improved. Scarborough General has been in the news a lot, oftentimes, not with some of the good things, but that much has been happening. So whereas sometimes you find that if you go to the emergency room, you may have some wait, we've been looking at that. We sought to commission an area for level 4 and 5 triage area. There have been some challenges, and we've been meeting on those to make sure that we see some improvement in terms of the wait time for our clients. We have since engaged a full-time consultant in addition to those we have. We expect to engage a triage doctor to make sure that we provide the services and to ensure that people do not wait very long for their service. Let me just also point to another group of persons that are important in terms of the services that we expected to provide. So when we come to the hospital, we generally provide services for everyone. However, we felt that it was important to look at all the groups in our population. And so we've been looking at our men, we've been looking at our women, we've been looking at our adolescents, and soon our adolescent care is going to be provided to them in a different space, because we need to have a different environment in which we provide care to our adolescents. And so we've been working with, and as I said earlier, we are forging partnerships, building partnerships. Our partner in this regard is the Family Planning Association. They've been partnering with us in many areas. We have an MOU with them, a Memorandum of Understanding, and they will be providing for us the sexual and reproductive component of that service for our adolescents. But may I say as well, that is not the only area that they've been giving us support on. They've been giving us support for our women's health initiatives, and we want to thank the Family Planning Association for their efforts as we work together to improve the services to our population. In addition to that service that is for the adolescents, may I say that there's a crossover between the services, or there is collaboration between our Family Services Development Unit and the health sector in terms of providing a service for adolescent mothers. And so a program for adolescent mothers allows for us to manage their babies at our center while they're exposed to numeracy and literacy skills, such that 1 year later, we expect that they will be much more empowered to take care of themselves and baby. And that is an effort that we continue to build on, such that we provide the care that our adolescents require. But one may say we're speaking to many, many areas, and sometimes we oftentimes do not recognize the impact a service like for adolescent mothers will have on that particular group, especially because we keep your baby, we provide a caregiver while you go to school, allowing you to improve as you go along. In like manner, or emergency room, when we improve the service, you do not have to wait as long so that you can get in and out in a shorter time. But more than that, we want to improve patient satisfaction. We want to look at some of those admissions that may be unplanned, and therefore we want to see the extent to which we can improve on those areas. Madam Presiding Officer, permit me to also look at some of the other areas that we are looking at to ensure that we improve. The men in our communities have been experiencing some challenges. We have had sessions with men across the board. We have listened to their concerns and complaints. We have gathered the data, we have noted their lived experiences, and therefore much of what we will present and much of what we will offer them will impact and we think will contribute to the need that they now have. And we are working towards ensuring that our men's health and care for men will be provided in a setting that is much more improved and what is much more accessible for them. We really look forward to that particular area because they remain underserved. Let me just also point to a little bit on some of these issues that may continue to be under discussion. Earlier, I pointed to some of the functions in the health system, and generally, and even in some areas, I specified the provision of healthcare delivery. But there's an area of financing that continues to challenge us, and we can't escape that because that is one of our key functions. It is one of financing, but that we note that in some areas we've not been able to do as well because of our financing situations. We've been challenged because our salary cost by far exceeds what it should, and therefore with an 85% as against 15% for goods and services, it is quite a challenge. But we've been doing more with less. We've been relying on the skill and expertise and tolerance of our professionals such that we can continue to provide care. And so we want to continue working on those. Let me just also mention another area in terms of our management and some of the issues that surround that. in our renal disease clinic, and for those who do not know, it is located in the Scarborough Health Center. We have been faced with many persons now presenting for care, and therefore it is necessary that we expand the service. And just this morning I was talking to someone who said to me, I think we have 14 persons waiting on a wait list. That is no good news for us. And that's hence the reason why I was saying earlier, we have to exercise greater responsibility for health. So whereas we're seeing the need to expand, there is also the need for us to continue improving in terms of our health promotion and disease prevention, while at the same time recognizing and trying to manage those that are already ill. Let me just also look at another area that is in progress that will continue to improve the care for our clients. And so a public health laboratory that we know is important for us on this island, that will experience upgrades such that when we speak again or even before then, we will have a service that is superior, one that can provide the support to our Tobago population. Let me just also point to another area. Though we may say that it is hospital and we are not supposed to be talking about health promotion, in our hospital, because we recognize that the space and the environment in which we provide care must be looked at, we are moving ahead ensuring that our hospital becomes much more health promoting, and therefore our efforts in that regard will continue. The other area I wanted to point to as well is our elderly group, our aging population. Even today, we had, or it is in progress, or symposium, or elderly symposium, looking at elder abuse and rights of the elderly. For us, that's a group that we must take care of as well, because we are all in the same, we are all going to be, and for some of us, we are already there, and we expect that as we proceed to access care, that care is available to us. And the support required is also available to us. And so, recognizing that there are 8,000 persons over age 60 in our population, that should not be ignored. And therefore, we are moving aggressively to give them the kind of support. We have put measures in place and have put committees in place to monitor homes for the elderly. We've been providing support in their homes such that they get care, so caregivers go to homes of some of them, providing care. We have trained up some of our caregivers such that they understand how you manage the elderly, because we recognize that every group in a population must be taken care of. We believe that no one should be left behind. And so our men or women or elderly, and may I share with you as well, issues with respect to our disabled or differently able community. In our department, we have a disability unit, fledgling unit at that. However, we recognize that this particular group in our population requires support in terms of us responding to their health needs and so on. And that too has been getting the attention. We've set in place a Tobago coordinating committee for the differently able, so that the focus and that the support they require, that there's an overarching body responding to the needs of those 11 groups of groups and organizations, and ensuring that we can respond to what they need. And so that too is in place, and we look forward to interfacing with them such that we could improve as we go along. Let me just point to some highlights, because in my wrap-up time, I will have much to report. So, we have provided much support, but I wanted to point to the issue of the collaborations and what that meant for us. in terms of our services. I pointed to one collaboration, that of the Family Planning Association. May I also say that our collaborations with the Children's Authority is another collaboration that we have been benefiting from, or maybe they have been benefiting much more than we have, because we on this island, we've been doing much work to ensure that our children are protected. And so we have set in place a home for our children at risk. It's the first publicly owned facility on this island, and we, at great cost, we recognize it was important to put that in place, and we now have a facility providing services for children at risk. That was important for us because we want to treat with every group in our population. We want to make sure that we do that. You may recognize that we are in delivery mode, and may I say, in our review of, and most of us have been using our manifesto closely in the 3 areas that we have had to deliver, 3 headings in terms of our health area, or gender, or social services area. We are upwards of 80% complete. Now, that is no idle boast. The facts are there to show that we've indeed been working studiously to ensure that we deliver the results our population requires. But what else have we delivered? I just spoke to you about 10 new vehicles. That 10 new vehicles is no easy feat. And so we've purchased from backhoe to cesspool tanker to jeeps to all of that, because we understand that this administration, as we go forward, we are responding to a population that is in need. Another area that we've been able to do and to deliver as we seek to treat with the initiatives that I'm expected to point to. We have performed a groundbreaking surgery on this island. It has not been done in Trinidad nor Tobago before in the public health sector. And so the groundbreaking surgery of breast reconstruction for one of our survivors was undertaken successfully in Scarborough General Hospital. That's important to note. We've also, in terms of our women, ensured that the women are provided with a dedicated service, a service that we've launched only in May, and that upwards of 600 women have accessed that service. They have accessed that service such that they are able to benefit from their breast ultrasounds, their referrals for mammograms, and may I say that their pap test, the turnaround time for your results, 7 working days. We encourage our women to come and be screened. Why have we put that in place? Because we know that cervical cancer is preventable, and we are encouraging our women to come to be screened early so that early intervention, early detection can lead to early intervention. Let me just also say some of the other things that I did say I wouldn't speak about so many of them because the list is very long. Let me also point to an area that sometimes is ignored, the issue of succession planning. In this health sector, and recognizing the challenges that we faced, we've launched a leadership graduate training. That is important for us because we need to grow our leaders in the health sector for the future. And we have launched such an initiative because we feel certain in the coming years, those persons will be able to replace some of us because we are moving out so that they can come in. We have also looked at our facility where we dispose our waste, and that is important because this can impact the health of our population. and we've upgraded our study parkways facility. More importantly, the facility for our staff. Soon to come, we will look at our ponds and all of that, ensuring that we protect the waste, we protect our population such that they do not experience any negative effects. Let me just also pause. I want to pause a bit on some of the things that we've done to say to you that I'm going to share some of the new things later on.
Remember, you have 30 seconds. Go ahead. You have 30 seconds.
Oh, they did it quick. All right. So in my 30 seconds, let me just quickly say as well that we've been able to do quite a bit. We've been able to leverage the areas on decentralization of service delivery. We've been looking at health promotion and disease prevention. We've been looking at the extent to which we can improve care, both at the primary and secondary level. More importantly, we continue to respond to the needs of our population, ensuring that their needs are met. I thank you very much for this opportunity.
Members, the question proposed, whereas one of the fundamental pillars upon which any society develops is an effective healthcare system, and whereas this administration, through the Division of Health, Wellness, and Family Development, has been leveraging the decentralization of an improvement in healthcare in Tobago, be it resolved that this House take note of the initiatives that have been implemented in improving the delivery of healthcare, effective healthcare on the island, and be it further resolved that this House encourage the Tobago population to access these newly decentralized services and continue to participate in the community engagement exercises of the division. Member for Palatuvia, Lansome, Speyside.
Thank you very much, Madam Presiding Officer. I also wish to begin by thanking you for your kind words of condolences. I wish to also thank my colleagues, the minority colleagues who have been unwavering in their support and also patient, because there were many days, and in some instances, weeks, that I had to be away from duty. I also wish to thank my colleagues on the other side, and I have received many goodwill messages from almost all on the other side, inclusive of the Chief Secretary, who within 30 minutes of her passing did reach out to share his condolences. And I must also thank the many, many Tobagonians who have been reaching out in various forms. It has been difficult to respond to all in a timely manner, but I wish to say to all that my family and I, we do accept and we do appreciate more so all of the goodwill that we have been receiving. It isn't missed on me that the irony in this moment that we are debating a motion that treats with healthcare on the island of Tobago, and I am forcing myself to speak for a few minutes, just a few minutes, 2 days after the passing of my mother. And also we are having this debate in the month through which we celebrate cancer awareness, and on the same day in which we are having a symposium treating with elderly care. And so I guess discussing health care is perhaps most apt at this juncture. Madam Presiding Officer, I never thought that on January 26th, when my mother accompanied me to the house for the inauguration, that would have been her first and last time in the house. She was never really into the politics. I think I would have picked up that gene elsewhere. She preferred a life far removed from the public's eye. For some reason, I have not been able to resist that public life. But I just wish to share 4 brief things to this motion that I think we need to consider. In fact, I had a presentation done pretty long in advance, but I don't trust my emotions in this moment to present that successfully. And so I just wish to share 4 points. The motion asks that we resolve to take note of the initiatives being implemented to improve the delivery of effective health care on the island. And secondly, it asks that we encourage the Tobago population to access these newly decentralized services and to continue to participate in the community engagement exercises of the division. I wish to say firstly that I have always participated in these community engagement exercises. Whenever they roll into my electoral district, I will always try to pick at least one of them and try to participate. And I'm not sure if that's the case across the board, but I genuinely try to participate and to be there as members of the community will speak to the issues that challenge them in terms of healthcare. But I wish to share 4 things. The first thing is that success in healthcare cannot be measured by an increase in the number of people that access the services. And I've heard the increase in the numbers in our lifestyle clinics, and that should be more worrying than something for applause. Because if year upon year the numbers are gaining, at some point we will never ever be able to afford it, and at another point it means that the system just isn't working. Because if the healthcare system is working, what should be happening is that the number of patients in some of our clinics, especially our lifestyle clinics, should be decreasing to the point that we run out of patients. That's how you know that we have success in healthcare, and not necessarily with an increase in patients. And so we have to change the philosophical outlook in terms of how we see healthcare. It has to be much more than trying to provide healthcare to remedy people's ailments in increasing amounts, but look at how do we decrease the number of patients in some of these clinics. And I'm heartened that the Secretary indicated that she is data-driven. And so if we are data-driven, it means that we should have sufficient data to not just tell us the numbers that are getting sick, but we need to begin to do some research into the whys. What's causing it? So that we could begin to, in a real way, address the issues that we have. In fact, I was at a community engagement exercise in Charlottesville when I heard the councillor speak to the fact that my area of the island perhaps has the greatest saturation of cancer patients. That's good data. But have we gone further in our research to begin to look at what might be the cause? Is it that country people just more genetically predisposed to having cancers? Is it our exposure to something else? And I know that kind of research requires a lot more resources and requires a lot more skills than we may actually have on the island. But healthcare is one of those areas where we cannot be xenophobic with. We just have to take the best practitioners from wherever they are in the world and engage their services. And so success in healthcare, firstly, cannot be measured by an increase in the number of patients at some of these clinics, but rather in our ability to decrease patients in those clinics because they are doing better. Second point I wish to raise is that success in healthcare also cannot be measured by constructing a rainbow of rooms. We could build rooms of every color in the rainbow. That in itself does not necessarily lend to success in healthcare. The ultimate question is, for the facilities that we do have, what is the quality of these facilities? What's the quality of the delivery of actual healthcare? And we have to do a lot more work in terms of improving the confidence that people have in the healthcare sector. And the motion asks that, we encourage the Tobago population to access these decentralized services. And that brings me to the third point, which is that people really don't have confidence in the healthcare system. It's amazing the amount of complaints you will have about the healthcare system and how it works. And, I want to pause to thank our healthcare practitioners, because most times we do not thank them. And the reality is our nurses, our doctors, our first responders, they receive the brunt of Tobago's anger. They receive all the bad words and all the cussing and all the quarreling. They receive it all, because when the system doesn't work, unfortunately, people automatically attribute the blame to the healthcare practitioners who are on the front line. The same healthcare practitioners that don't know how to say to the patient, this machine is down, or this isn't working, or we don't have access to this right now. And they don't know how to say that to a patient that is really in need of it, and who may not necessarily have the resources to get the access privately. And then the fourth point I wish to raise is that decentralization will not work if there isn't sufficient resources to match that decentralization goal. Now, I agree with decentralizing the services, because it means then that people can have access from various points of the island. But for that to happen successfully, we simply have to match that with sufficient financial resources especially. If it is, we must take from the general hospital in order to supply a pink room or a blue room, then it means that our decentralization efforts will be to naught. The resources we have must be sufficient to be shared among several new units. Because remember, if it is we were working with a general hospital and a specific list of health centers, and then we start adding several clinics and units, we can't expect the new clinics and units to work sufficiently and to work effectively with the same limited resources that the original clinics had at their disposal. So if decentralization has to work, we have to actually increase the resources being placed in healthcare. Or else all we'll be doing is spreading even much more thinly the limited resources that we do have. And, I heard the secretary speak in particular about some of the services available at the Pink Room, one of those decentralized units. And I have had to use that unit recently. In fact, I didn't get to use the unit. You know why? Because one of the services she mentioned, mammogram, wasn't available there. It just wasn't accessible there. I don't know if it is now, but it wasn't available there. And it wasn't available there. Eventually, I got it done at Cutler Hall. And then when I got it done at Cutler Hall, I had to wait a month because I got it done on the 19th of the month, and Cutler Hall brings someone up on the 18th of the month to do the reports. And so stories like that aren't uncommon, they aren't uncommon at all. And several Tobagonians know what it is to have to wait inordinately long to get simple results back. There are folks waiting on blood tests done at the hospital for over a year, and they were never called back to receive those results. That too is not uncommon. And so one of the questions we have to ask ourselves is it that we should rush the decentralization process, or should we use the limited resources and try to make better the actual facilities that we do have? Or, thirdly, are we going to pump more resources into the system so that we can do all of these things simultaneously? Now, we can simultaneously decentralize and improve the services in our traditional clinics and units. But for that to happen, we have to make available a greater amount of resources. And I have had to go to Facebook, I've had to quarrel, I've had to get angry. I've been to funerals where people feel as if their family member shouldn't have died because they weren't given a fair chance. I have seen it, I've heard it. And at the end of the day, all of this will be naught if people don't have confidence in the system that you're operating. And Tobagonians do not have confidence in our healthcare system. They just don't. They think it doesn't work. And so what we have to do in order to encourage them to engage the services that are available is to simply improve on the services that are available. It is a work in progress, and I don't expect it all to be done overnight, because we are battling with decades-old problems. However, people must see an effort in the right direction so that they can actually have a sense of hope, and they can, believe that the system will work. For me and my recent experience, I had a fairly good recent experience. And at one point, I said to myself, well, maybe this thing ain't so bad at all. And then a healthcare practitioner said to me, I wish what you are getting is how it worked for everybody else. And when he said that, I was, one, alarmed, and two, I was saddened by the reality that most of our people really do not get the kind of quality service that they need and get it on time. And so, Madam President Officer, I wish to end by saying to the House and saying to the goodly Secretary that decentralizing is laudable. However, for it to work, we have to have sufficient resources to be able to do it. If all we have is the same limited resources, then all you are doing is spreading much more thinly the limited resources that you have, and it does no one any good. And secondly, I wish to say to our healthcare practitioners that you have to try harder. And even if the system you operate in is a crappy one, even if you hate your supervisors and hate your administrators and you think they are not doing well, you are doing Tobagonians no service when you pass on that same measure of hate in your treatment to them. And so wake up every day. In the midst of your hurt and your pain, wake up every day and say to yourself, I am going to try my best regardless. I am going to give it my best shot. And we cannot pay you for your extra hours. We cannot pay you for going above and beyond. We cannot pay you for calling specialists in Trinidad that you might be friends with and begging them to take in your mother and to assist them and so on. We can't pay our healthcare practitioners for that. But that is just about being a good human being. And so a lot of the bad experiences people are feeling is because you are transferring your feelings towards your administrators and towards the system on your patients. And that cannot be healthy, that cannot be professional, that cannot be good for the system. You must rise above the bad system and try your very best. Even if the best doesn't work, at least you tried your best. And I wish that every Tobagonian, when they go to the hospital, will be given the same measure of treatment I received. And I purposefully attended every single clinic with my mother, every single testing to Trinidad, to Tobago. I did it all. And you know why? Because I realized that as I got to the hospital and they saw my face, almost instantaneously I got treated with. And it really should not be that way, especially for emergencies. That should be the case for almost any Tobagonian. And not that I'm saying I didn't want the good treatment, but I'm saying I want that good treatment for all of our people. And so I beg you, healthcare practitioners, you have to help us, because people will not trust the system if you do not come across as being trustworthy too. And with these few notes, Madam Presiding Officer, I am going to be uncharacteristically short. And I'm going to apologize in advance to the Secretary for Health that I will be leaving early, so I will not be here for the closing up of the motion. As a principle, generally, I like to stay throughout the debate and listen to all parts of the debate. But I pray that this House will understand my early departure. Thank you very much.
I'm sure the House accepts that you will have to leave early, Assemblyman. The Assistant Secretary in Community Development, Enterprise Development, and Labor.
Thank you, Madam Presiding Officer. Permit me, colleagues, to begin my contribution to this very important and timely motion by again extending condolences to my Assembly colleague, minority member, Deputy Political Leader, and Assemblyman Fari Augustine on the passing of his mother. And in so doing, let me also put on record how pleased, how encouraged, how inspired and motivated I am, having had him dignify the office he represents, even in the face of bereavement, by presenting himself here to treat with the business of the people of Tobago in spite of his circumstances. I would dare say that if there is no other indicator of severity in public office, that bears eloquent testament to the fact that the gentleman is of a higher order of moral consciousness and perhaps spiritual clarity, and I want to commend him publicly for such. This motion, of course, comes to bear on a very topical and sensitive matter. I want to, however, backstep just somewhat without being argumentative, combative, or confrontational to share some personal experiences that I have received and the quality of care afforded me at the Scarborough General Hospital and in circumstances where I was not immediately or automatically recognized. Now, the member opposite credited the care that was received because of his station, and I do not at all doubt that rank ought to have its privilege. In fact, it is commendable to recognize that rank must have its privilege. But I too would have been the beneficiary of a quality of care. And it was certainly, in my assessment, not because of my rank or my office. In fact, in the last month, I would have had, if I am permitted to share my own testimony and my personal business with this House, I would have had occasions to take my son, my recently born son, to the hospital for what we had believed to be a seizure or seizure-like manifestations. He was taken there and was diagnosed. The information came back to us that it was, in fact, Doc, what's the name of the thing? What's the name of the thing? Some Cassifer syndrome or something of the sort that resembles that resembles a seizure. And what was instructive is that while there, he was well attended, as was myself and his mother. And the night when I was leaving, a nurse who is a friend of mine said, Shumari, you're finally getting to go home, and you're finally getting to carry home your son. And the nurse who was providing us with the quality care throughout our length of stay in the hospital said to me, I know your name sounds familiar. You are the Shumari Hector. You are the politician. And I was impressed. I was impressed because I had an appreciation in that instant, in that moment, for the fact that the quality of the care she provided myself and my family had nothing to do with the office I represent, because in fact she did not associate me with that office. And I want to commend that officer and all such officers. Madam Presiding Officer, this motion calls for us to be able to have an appreciation for the fact that from day one, having assumed office, the Chief Secretary and political leader under whom I am pleased to serve, instructed myself as well as his entire Executive Council colleagues that the jurisdictional walls of Jericho must come tumbling down. So much so that the tearing down of these jurisdictional walls allowed for the interrelatedness and interdependence of the services afforded throughout the length and breadth of the divisions of the Tobago House of Assembly. As Assistant Secretary in the Division of Community Development, Enterprise Development and Labor, I am pleased to be able to confess, and with joyful tone, that sincere and strategic collaborations have been taking place between the division I represent, headed by my successful, beautiful, powerful, visionary Secretary, Assemblyman Marcin Melville Jack, and that of the Division of Health, Wellness and Family Development, in addition to all the other divisions in the island of Tobago. You see, Madam Presiding Officer, the first thing we did upon assuming office was to mount up a public awareness caravan to go to community by communities across the length and breadth of the island of Tobago to advise them of the new strategic mandate, vision, and direction of our division. And that initiative was aided by the input of the Division of Health, Wellness, and Family Development and a few of the stakeholder agencies associated with the services offered there. Madam Presiding Officer, you would have heard a few minutes ago that the Secretary herself would have indicated that post that exercise, she too would have engaged in a community sensitization and consultative process through which she would have spoken with the Tobagonian people to have an appreciation for their lived experiences, the realities of the experiences that they ought to experience, and how those things can be aligned to the new vision and focus and the services delivered by the Division of Health, Wellness, and Family Development. I can say with certainty that I was present at one such consultation, which happened in the Bethel Community Center, and we were very pleased then to have heard about all of the plans that are being put in place in respect of the Pink Room and the Blue Room, women's care and men care. I don't know that it is fair to call that type of arrangement a rainbow-type planning structure. I don't know that it is fair to call that type of activity facetious. I don't know that it is fear that that should be looked at with a surface level, or perhaps in this instance, a surface depth analysis, simply because the individual experience was one that perhaps translates into something uncomplimentary or otherwise. I can say with certainty, and I could put on record, that while in Europe, I had the cause to go to seek medical attention. I was stunned to discover that I was not taken to the general hospital. So I said, well, what's going on here? Take me to the hospital. I really aren't feeling good. I think I need some real critical medical intervention. And my friend whose house I stayed at, he said to me very calmly, unless you're very close to dying, I cannot take you to the hospital. I have to take you to the community clinic, because nobody will be referred without a statement of referral from their primary health care providers. And I'm saying, Madam Presiding Officer, that we have come to the point on the island of Tobago, and the Secretary with responsibility for health, wellness, and development has encouraged the operations of her division and provided the quality leadership to ensure that as much attention is put on the delivery of primary health care services in keeping with the needs and the demands of secondary health care services, to rank Tobago's operation and medical service delivery processes with that which is comparable to first world nations such as the UK, Europe, and the likes. And I want to commend the Secretary for that. You see, it is said, and I have been the recipient of such a claim or such an onslaught, that no king has honor in his own country. And I've had an opportunity to hear a lot of attacks being levied against the operations of the division and the TRHA, as well as the secretary, and to a lesser extent the administrators. Somehow administrators always get off easily. I have heard those accusations about the secretary being levied, but I can say with certainty, having been engaged in intellectual conversations regionally and internationally, having had an opportunity to go to hear the presentations of papers and scholarly works and the likes, and having had an opportunity to be in the audience at a presentation made by the Dr. Agatha Carrington, I could say with certainty that her fame is recognized regionally and internationally, and the Tobagonian people just simply have to get on board. Have to get on board. I want to predicate all of that against the backdrop of a publication made on a Facebook post, if you would allow me, Madam Presiding Officer, by a member of a political organization that is not amenable or sympathetic to the one I represent. And he said in a post, and I have it here, let's hear your good experiences at the Scarborough General Hospital. There were, at the time, 69 comments, and I had an opportunity to go through, at that time, all that were positive, and only one experience was uncomplimentary and perhaps unwholesome because of some flaw in the character trait of the individual who posited the information. I can say, just to quote a few of the persons who would have benefited from the quality of care, and I'm quoting after them. After spending 2 months in the Scarborough General Hospital on maternity ward, there is not one bad thing I could say about my treatment on that ward. Nurses, doctors on maternity, and the likes on the ward were walking angels. One person commented on that, having regard for the association of the services and the individuals as walking angels. The person said, after I made my baby, I miss every single one of the nurses and the doctors in the hospital. Wish I could have carried them home with me. Parenting ain't easy. Parenting ain't easy. Another, and I would just quote one more, another person said, let me look for a good one because I want to put this in context. And not a long one, but a very good one. Let me go to the maternity ward again. Surgical and A&E nurses and doctors were exceedingly good to me. Just one bad experience was registered, and it was not enough to overturn the beauty of the experiences I had there. Madam Presiding Officer, those are experiences posited on social media by persons who would have been the recipient of certain kinds of quality services and the likes. And I can say with certainty that the Scarborough General Hospital represents a single facility and a single institution. And so it was against this backdrop that this quality of care was determined to be made available to persons throughout communities on the length and breadth of the island of Tobago in respect of the decentralization of the primary healthcare services afforded by this division. Madam Presiding Officer, I can say with certainty that the Pink Room bears eloquent testament to the fact that our women, our sisters, our lovers, our mothers are in good hands. And in the not too distant future, I can say this, I will be able to say the same of myself, my father, my brother, my uncle, my friends, that men will have equally good services afforded them in the Blue Room. It is true, of course, that nobody should try to trivialize the experiences of persons seeking medical services by trying to associate an inflation in numbers with the kind of care that is given. Certainly, one cannot say that because 600 women visited the Pink Room that our quality of care is improved. That is true, and so I could agree with the member opposite, but what can be said about the 600 persons who visited that Pink Room is that 600 persons have been brought closer to information that can allow for early detection, prevention, and intervention. 600 women now have an opportunity to go back to their homes, their families, and their communities and share the good news about the gospel of the Tobago Regional Health Authority and the Scarborough General Hospital. 600 women now have an opportunity to provide care, information, and education to the ones they love and the ones in whom they come in contact. If that is not a testament of an increase in the quality in respect of the good of medical services, then I have to just say, my friends, stick with it. Because where men have done their best, angels can do no better. Where men have done their best, angels can do no better. Some of us might want direct intervention from God. The Stroke and Diabetes Clinic, Madam Presiding Officer, is also, or center is also one facility that continues to provide care. The Ankle and Foot Clinic. Today I had an opportunity to go to the Elderly Symposium, and I was quite impressed. I was quite impressed with the number of young people who were present at the Elderly Symposium. In fact, before I made my departure, I had conversations with a few of these young people, and they told me they came for the information because they have primary responsibility for the care of their older loved ones. Commend that. Commend that. Madam Presiding Officer, it tells me that the focus, the vision, the mission, and the mandate of this division is in keeping with the best possible good that can be afforded to the people of Tobago. I want to point your attention quickly to the type of collaborative initiatives which I had to reference earlier. I envisage, and I am hoping that the senior members of staff, the administrator, and the likes at the division and other divisions would be able to take note so that I will not belie myself in the house. I am hoping that this kind of collaboration will one day yield the results where agriculture, the Department of Agriculture, those engaged in agricultural and agro-processing enterprises with URP as well as CPEP will be able to supply the Scarborough General Hospital with all of the produce needed locally grown so that they can provide needs for their clients there. I am hoping, Madam Presiding Officer, that the day will soon come when persons will pride themselves in knowing that, like me, they would have gone to distant countries and some illness or sickness befalls them, and they prefer to come home to get care because of the quality of the treatment. And might I say, we are drawing closer to such a day because of the stewardship of the Secretary of the Division of Health, Wellness, and Family Development. Madam Presiding Officer, I must give commendations to the Secretary, and I want to put it in context to the recently held graduation and exhibition ceremony, which started last night and is being continued as we speak right now by the division I represent. You see, last night we were able to provide certificates for persons in skilled areas for 39 different disciplines in almost 70 different centers, locations. Madam Presiding Officer, the persons who engaged these services totaled 1,378 individuals. However, 1,400 certificates were printed for distribution because some persons participated in multiple programs. I think that is commendable. Let us recognize the achievements. And I said that to say this, Madam Presiding Officer. The people of Tobago, in respect of vocation skills and the acquisition of entrepreneurial and employable skills, are recognizing that they must take responsibility for their own destinies. But it will be remiss of me if I pretend as though that this is a single achievement or a single accomplishment enjoyed only by the Division of Community Development, Enterprise Development, and Labor. In fact, my sister, who is a registered nurse, went back to school to expand the contours of her imagination, to further equip herself with the knowledge, the skills, and the opportunities that can redound to her providing better quality of care to the people of Tobago, simply because under the leadership of the great doctor, she was able to successfully create in the Scarborough General Hospital and under the TRHA a culture of learning in that workplace environment, and I think that is commendable. You see, my sister could have comforted herself in knowing that she went to school, came out with her certification, spent a little while in Trinidad trying to get a placement, finally moved back to Tobago. She's a registered nurse, she's earning a reasonable pay, and she's going home at the end of a long and meritorious service in the public sector. She could have been one of those individuals, but instead, she decided to expand her knowledge base to prepare for the further services that would redound from the further decentralization of the operations there at the Tobago Regional Health Authority and the Scarborough Hospital. Madam Presiding Officer, it bears eloquent testament to the fact that creating a culture of learning translates directly to creating a culture of care at the hospital. And take a dramatic pause and let that soak in. Creating a culture of learning speaks directly to establishing a culture of care, a culture of excellence in service delivery, and a culture of the recognition of the basic humanity and the fundamental human rights of each individual. You see, Madam Presiding Officer, my sister could have decided to go on a remote beach, get a bamboo javelin, get somebody to record the operations or the transaction which was about to take place there, pelt it down some omnibus distance that can't be measured neither in reality nor on the footage, and then make a public challenge to the Secretary for Health, Wellness, and Family Development as an indicator of her suitability for leadership. My sister could have done that. And all it would have done, and parliamentary privilege would not allow me to say that it would have made her foolish, but it would have certainly made her unbright. You see, Madam Presiding Officer, climbing a mango tree, pelting a bamboo javelin is not the same as planning strategically and taking decisive decisions towards leadership that would improve the quality of people's life. You see, Madam Presiding Officer, in fact, Let me piggyback on the example of the bamboo javelin. I was able to look at the video myself and to read some of the comments and to engage in the conversation. You know, the vast majority of people only called attention to the fact that the beach was so clean and they big up the Secretariat responsibility for environment and the work done in respect of coastal protection and the likes. And I want to join the members of the public and say, Secretary, Councillor Devines, you did well. Our coastal ways are well protected and will be acknowledged by the members of the public. And so, Madam Presiding Officer, with my very little remaining time, with my very little remaining time, I want to just reinforce the fact that the social services that are now offered through the collaboration with the Division of Health et al. And the Division of Community Development et al. In community centers allows for a deeper sense of the interrelatedness of the division, the interdependencies of our staff, the inter-transactions or interactions that happen as a result of the sharing of knowledge, information, and resources towards the improved quality of services delivered to the people of Tobago. Not only that, Madam Presiding Officer, testaments borne by the member opposite and sentiments expressed in my opening summation bears eloquent testament to the fact that the services now cater, unlike any other time in our history of healthcare, services to every age group, moving from infancy to elderly care. Madam Presiding Officer, one must have an appreciation for the fact that the extended hours of services in our primary healthcare facilities and our clinics translates into persons having an opportunity to treat with those medical issues which before them, long before they become the medical issues which lend to their demise, death, or even, or as some may say, detriment. Madam Presiding Officer, I want to end very quickly by calling attention to some basic facts. You see, part of the responsibility of responsible leadership is to be able to empower, is to be able to inspire, is to be able to educate. And I certainly think that the Secretary with responsibility for piloting this motion today has borne eloquent testament, and I'm using that word repeatedly because I want people to appreciate that it is a living truth, has borne eloquent testament to the fact that she has provided leadership, she has provided direction, she has provided inspiration, she has provided information. The record is here to show that she would have successfully hosted substance abuse symposium treating with illicit trafficking, where multiple persons and then additional 70 persons were in attendance, would have conducted parenting and co-parenting workshops for over 60 clients, would have appointed the Realization of Economic Achievement REACH Screening Committee to preside over grant applications made by the REACH unit, would have distributed 50 grants to vulnerable persons and appointed facilities review committees and the likes to ensure that you, the people of Tobago, could put your prejudices aside and engage the services offered by the division and the Tobago Regional Health Authority, knowing that you are in good hands. You have heard, Madam Presiding Officer, that nurses, doctors, and specialists will continue along the education and retraining and retooling trust to ensure that we continue to improve the quality of our services. Finally, I want to share a testament toward me by a member of staff at the division. I was in Trinidad with my son. When I met on the neonatal ward, a member of staff from the Tobago Regional Health Authority who too had a baby and was in Trinidad. And she said to me, I told her my experience. I said, Doc did everything for me to get me here today, boy. Doc put things in place, allowed my son to be transferred quickly because of the critical nature and the critical operations surrounding his birth. And I started to have conversations and the likes. And she stopped me to punctuate my presentation to her to tell me of a personal experience. She said when complications befell her prior to the delivery or the extraction, rather, of her baby, the doctor, the secretary, was there. She said when she had an opportunity to be airlifted to Trinidad, the secretary was there. And she said when she was admitted to the ward, the secretary was there. The secretary was there, even though when she was leaving Tobago to be airlifted, the secretary told her that she had a 7 o'clock commitment and that she does not know what might happen, but to hold the faith. In spite of the 7 o'clock arrangement, the secretary was there. Not only was she there, she was back in Tobago on time for the 7 o'clock arrangement. If that ain't God made manifest in man, then nothing can be. And so I want to say that whereas there are a few persons who would be able to say that the service levied on them was inhumane or unkind, the vast majority of people have an unparalleled, unequaled, and unmatched appreciation for the new thrust, the new direction, and the new quality of services which have been administered via the Scarborough General Hospital under the auspices of the Secretary and the Tobago Regional Health Authorities. And if that is not a good note to end on, nothing should have been said from onset. Thank you.
Councillor Dr. Faith B. Israel.
Good day, Madam Presiding Officer, members of the Assembly, and to those who are visiting with us, and who are viewing this presentation on the various media options. Madam Presiding Officer, I'm standing here and I'm baffled. I'm baffled, and probably unlike my colleague, Assemblyman Farley, I don't know that I can really control the emotions that are running through me right now. Because when you listen to the motion, and when you listen to the aggrandizing of the Secretary and the Assistant Secretary about what they think is happening on this island, I have to wonder if they live on this island. Madam Presiding Officer, what is happening today in this house that is being recorded and placed on the Hansard is an insult to the person who went up to the hospital this morning about 8 a.m. with severe belly pains, bleeding, and listening to this right now because they're still in A&E waiting at this moment and have not been seen. What is happening here? I really don't know if those of us who are in this room, who are around this shoe horse on that side of the table, really understand what the average citizen goes through as it relates to health care services. What they're practically telling us is that what we get here is good quality, and that it is time, given that we have such good quality, that we expand outside of the, 17, 18 health centers and the hospital, expand outside of that to bring services even closer to people. And in a
in a world where the current system works, that would be great. But we are currently in a system, Madam Presiding Officer, where we do not get the kind of quality health care that most of us expect to receive. And when I say quality, what does that mean? Madam Presiding Officer, quality is something that is pretty difficult to define. But most people who are in the field agree that it has three main components. Quality involves meeting or exceeding customer expectations. Quality is dynamic, meaning what is considered quality today may not be considered quality tomorrow. And finally, no matter where you are, quality can be improved. Those three things make up quality. According to the Institute of Medicine, they had a specific committee that was set up and did several reports in the 1990s. They defined health quality as, and I quote, the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. I ask everyone sitting here, everyone viewing, everyone hearing my voice, to think critically about the last time they directly or indirectly received health care in Tobago, and to ask yourself whether it really is or it was to a degree where the services for individuals and populations really increased the likelihood of the desired health outcomes and was consistent with current, today, 2019, professional knowledge. Madam Presiding Officer, the same Institute of Medicine Committee did a report entitled Crossing the Quality Chasm, a New Health System for the 21st Century. And this report identified 6 main dimensions that we need to continually look at to ensure that we continually improve the quality of care that we receive. And those 6 dimensions, Madam Presiding Officer, are 1, safety. And what does this mean? Care intended to help patients should not harm them. 2, effectiveness. Care should be based on scientific knowledge and provided to patients who would benefit. Care should not be provided to patients unlikely to benefit from it. In other words, we should not have overuse or underuse of services. 3rd one, patient-centered. Care should be respectful and responsive to individual patient preferences, needs, and values. And patient values should guide all clinical decisions. 4, timeliness. Care should be provided promptly when the patient needs it. Efficiency. Waste, including equipment, supplies, ideas, and energy, should be avoided. And the last one is equity. The best possible care should be provided to everyone, regardless of age, sex, race, financial status, or any other demographic variable. And I would add, including being a member of the Assembly. Those are the 6 dimensions, Madam Presiding Officer. And again, I would ask all of us who are here to think back at the last time either you directly or indirectly received health care services.
Was it safe? Was it effective? Was it patient-centered? Was it timely? Was it efficient? And was it equitable? And then we can stand here and be boastful in our commentary. Madam Presiding Officer, as I have previously stated, practically and every time I stand to speak in this house, that we usually share the motions with the public who placed us here to ensure that every time we speak, we really speak on their behalf. And after I did this for this motion, there was one theme that kept ringing over and over and over and over. And by the way, I would state now that because of fear of victimization, 95% of those comments came into my private inbox. They were not sent publicly. One person who was brave enough to write it publicly, after responding to someone who said they are happy about the hospital in Roxborough, the person responded and said, nothing wrong with Roxborough getting a hospital, but address all of the issues at the major one up the hill first now. Ensure it have adequate resources, adequate staff, all equipment functioning with effective maintenance. And that is something that resonated with practically all of the comments that were raised. People cannot get excited, Madam Presiding Officer, as much as we would like them to, as much as I would personally like them to. They cannot get excited about a pink room or a blue room or any other color room if the services they are currently receiving at the rooms that have no special color are not up to decent quality standard. Think of it, Madam Presiding Officer, like a house. We have a family living in a house. The house has a leaking roof where when it rains, you get more wet inside than outside. And in addition to the leaking roof, you have electrical issues. Now, we would all appreciate that the combination of a leaking roof and electrical issues is a bad combination. It is not just uncomfortable, it is downright dangerous. Madam Presiding Officer, think about a situation where, for example, the father of that house came into some back pay. And he decided that instead of fixing the roof and the electrical issue, he would put in a swimming pool or a guest room. Any right-thinking person would understand that even the youngest child in that family cannot get excited about the swimming pool or the guest room because they are getting wet, and possibly the fridge, the microwave, and the whatever just spoil because the electrical issues are so faulty. That is a rational response to what we are seeing here. And for members on the other side to get up today of all days, given, let me not say that, to get up and speak about what is happening as if there are no issues, and to simply ignore all of the comments that are out there. You hear them, you just have to turn on Radio Tambourine, you just have to turn on Channel 5, you just have to turn on, and you hear people calling and complaining about these things every single day.
and to come here and pat yourself on the chest and pat yourself on the back and to thump your chest as if, well, what we are doing is great, so the addition would be praised the same way, is showing that we really are not aware of what is happening outside there. Or, Madam Presiding Officer, it means that the other option is they are aware, but simply do not care. When I asked for comments, they came from regular people, but they also came from doctors, nurses, lab techs, imaging techs, EMTs, cleaners up there, everything. It came from everywhere. And allow me, Madam Presiding Officer, to read verbatim what some of those comments are, because it seems like those of us who are in this room, who are relatively comfortable, need a reality check about what is happening out there. One comment. We have no IV, Gravol, or Maxalon, which is used to control nausea. We didn't have liquid Panadol in the walk-in for children. We don't have the rectal Panadol for them if they are vomiting. The person was honest enough to say that they just got some liquid Panadol, but they did not have it for quite some time. We didn't have nebulizer medication for a long time. That is the medicine that we need for asthma patients. Another person, my son was having an asthma attack. She did what we told her to do. She went to Roxborough after 4 and the walk-in clinic was closed. She went to Bacolet because she understands that the only thing she really needs is the spray, the puff spray for her son, so she did not want to go up to the hospital. She went to Bacolet. She was told at Bacolet that they are not accepting any more patients. She argued with them until she told them, my son is going to die. I am not leaving this place unless somebody does something. When they recognized that she was serious, they pulled her in because it really only took somebody getting that and doing the spray. The pharmacy services are decentralized only in space, but not time. Because the community pharmacist usually works alone, the person said, they come in early. They work through their lunch, which is the busiest time, and then many times they leave by 2:40, 3 o'clock. So if you come into the walk-in service after 4, you will not be able to get a medication, even if you are actually seen by the doctor. Another person said, so there is a pink room, but the Cancer Society initiative that used to be in Bacolet is not functioning because their space is overrun with mold. Another said, this is not decentralization. This is duplication. We in the TRHA don't know what they are doing in all of those colored rooms. Decentralization means working with those of us in the system to bring the services closer to the people. It does not mean bringing other people from Trinidad or elsewhere when we need the staff in the hospital and health centers right here. This is not decentralization. It is just duplication. And as my colleague rightly said, if we do not have enough money or enough resources generally to deal adequately with the services that we have in the how many health centers and the hospital now, adding additional bills does not make it better. Another said, she has hijacked and sabotage primary care in order to stroke her ego to fix her ribbon cutting syndrome. We have 17 health centers running at half of their capacity, more per capita than anywhere in the Caribbean. Call me crazy, but if these were operating at their fullest, would we have need to invest in all of these other things? Another said, how about utilizing the health centers to do yearly physicals for students every year before they return to school? What about doing other things in the health centers during the time when they are currently closed? Wouldn't that help some of the situations? Another said, no reagents for cholesterol, none for A1C. Another said, can't get an x-ray. Another, current healthcare workers forced to work in mold and without air condition because they are busy spending money. I wouldn't finish reading that part. Another one, incinerator not working. Another one, no gloves, no bed sheets, lack of medicine. Another, they reduced our budget in the lab, so we don't have reagents to do simple tests. But we are outsourcing to other labs and paying their big bills. That making any sense? I am sure if they gave us what we needed, we wouldn't have to outsource. Another, faith, they are going to kill people. That blue room, they are placing in the old hospital. Remember, we moved from that building because of the faulty electrical issue, because of the mold, because it was structurally not sound. And they are now just putting paint on it and carrying people back into it. That building was never decommissioned. So all of the radiation, all of the germs, all of the everything that is up there is still up there. And we are putting people to go back in that building. The last one. Decentralization was initiated long before she came. Medical outpatient clinic in Delaford with renal too. But they demoted, and the person called the doctor's name to a, I won't put his position. Now there is no renal clinic in Delaford. No ethics committee for AV fistula placements for hemodialysis patients anywhere in Tobago. This is re-centralization, not decentralization. Madam Presiding Officer, when I tell you those were just a few of the comments that we got about the services, those were just a few. While coming down, while coming in the Maxi today, somebody met me and told me that they know somebody who is waiting to do a particular surgery. It's not life-threatening. It's an elective surgery that they want to do, so it's not a life or death issue. But they've been waiting for over a year, because every 3 months when the surgery is scheduled and they show up and they go and so forth to do the surgery, because it is elective, Madam Presiding Officer, they tell them that they have to cancel because they don't have a lot of anesthesia, and they want to save the anesthesia for the emergency issues, for the surgeries that have to happen. That person has been waiting for a year. Madam Presiding Officer, we can't have a leaking roof and faulty electrical wiring and expect the family members to be happy that you are putting a pool or possibly building a guest room. Madam Presiding Officer, given everything that you said, and I want to echo the sentiments again of my colleague who spoke to the workers who really do get the brunt of the anger. Because the reality, Madam Presiding Officer, is that people don't go to the hospital because they are happy. People don't go to the hospital for a good time. They go to the health facilities because they are sick, because they are not feeling well. So their interactions with the health professionals are not always going to be pleasant. Yes, the health professional needs to be able to forget everything, in essence, and still treat with each patient the best that they can. But the reality, Madam Presiding Officer, is that a toxic work environment can turn the best health professional into a bad one. A toxic work environment can turn the best into a bad one if they keep getting consumed by the toxicity of the system that is currently there. So that needs to be worked on. When we are sending staff on administrative leave and no one knows what that's for and what was the outcome of that, and some of them who were on administrative leave, their contract just happened to end during the time of the administrative leave, so they are no longer employed. Just so. Just so. You have other workers who are saying that. And of course, that is preventing them from being the best that they can possibly be. When you have workers who are owed gratuities, who are owed CME refunds, who are owed all of these things, you cannot really expect the best from them. We have to give them an incentive to be the best that they can be. When you have workers who are called into meetings and berated, shouted at, threatened with dismissal, obviously, you can't expect the best from those workers. I understand that after a meeting recently, comment that was made is, I cannot sleep. After attending that meeting today, I'm ready to pack my bags and leave this place. That is the mindset of the health professionals that my colleague is begging to still do their best. But this is what they are dealing with on a daily basis. One of them summed up for me what they think is happening. And it says, lack of concern for staff welfare, expansion of services in the face of staff shortage, poor infrastructure, lack of equipment, poor maintenance, emphasis on new projects that offers what already exists in the system, but neglecting to improve the system. Extreme neglect of primary care, which should be our focus. Square pegs in round holes are just some of the ways our healthcare professionals, how they feel about what is happening. The reality, Madam Presiding Officer, is that a system is made up of components that work together. All of these components need to be working for the system to work. We currently have a healthcare system where many of the components are simply not functioning. And it is an insult to all of those hard-working people up there who are trying to hold the system together for us to come here and boast about how well the system is working while they are up there now in hot room because it don't have something as simple as air condition. It is unfair. Madam Presiding Officer, before I take my seat, I would like to also raise an issue that I heard a media personality ask the Secretary for Health, Wellness and Family Development, because one of the issues that we've always spoken about is the ambulance service in Tobago. We've always either not had enough ambulances, and there is a perception, and probably rightly so,
that the ambulance service really is just transportation to the hospital. Now, I did some research, and I discovered that, and I would ask the secretary to correct me if I am wrong, that the Emergency Ambulance Services and Emergency Medical Personnel Act, Chapter 2902, which was assented to in January 2014, speaks about, Schedule 5 of it, speaks about 4 levels, 1, 2, 3, 4, yes, 4 levels that a person who, in essence, works on the ambulance can be certified as. Those are Emergency Medical Technician Basic, EMT Intermediate, EMT Paramedic, and EMT Instructor. If I am not mistaken, what we have in Tobago is the EMT Basic. What does that mean? According to the law, it means that our ambulance services can only do the following, and I quote, administer basic life support, including airway maintenance, use of combitude or laryngeal mask, respiratory breathing support, and stopping of hemorrhaging or bleeding. Administer oral medications like aspirin, it's very simple, inhalation medication like albuterol, and do subcutaneous injection by an auto-injector only. So it means they can't even really do it. They have to use a machine that does it for them. By comparison, and that is what we have here, by comparison, Madam Presiding Officer, the EMT intermediate provides everything above, plus endotracheal intubation, which is putting the tube, you know, when you see on TV, they put the tube down your throat to allow you to breathe. They could also give a wider range of oral medications. So, for example, if you are having severe chest pains, they can give you glyceryl trinitrate, which is a medication used for heart failure, high blood pressure, and so forth. The EMT paramedics, Madam Presiding Officer, can do everything above, plus do, you know, the pumping of the heart. They can do the needle chest decompressions, what we see on TV, where the persons can't breathe because their airway, the area around their lungs is full of air, and they stick the needle inside of you and release the air and all of those things. Those are the things that they can do in the EMT paramedic level. So when we watch TV, you know, all of the things that you see on those medical shows, all of the things you see them doing in the ambulances on the way to the hospital, that make for really good TV. We do have the authority to do it here if the person is certified as an EMT paramedic. And the 4th level is an EMT lecturer, which is basically somebody who can teach all of those things. Madam Presiding Officer, one of the things that we continue.
Member, your speaking time has expired.
Madam President Officer, I wish to move that the speaking time of the Honourable Councillor be extended by a further 10 minutes.
Members, the question is that the speaking time for the honourable member be extended by a further 10 minutes. All in favour?
Aye.
Any against? Member, your speaking time has been extended.
Thank you, Madam Presiding Officer, and I'll probably just need 2 of those minutes, if that much. One of the things that we can seriously think about on this island is, given that we have such far-reaching places, such areas where the health centers don't exist, and since we've had so many instances where on the way to the hospital is when the person died, or if we had gotten a little bit more help in the ambulance, the person may have survived. One of the things that we can think about, and one thing that can really be a perfect example of doing what people have been clamoring for, is really thinking about providing services within our ambulance system that is beyond just the basic life support.
So let's look at upgrading our system from just basic life support to having EMTs that are intermediate or EMTs that are actually paramedic. Now, I raised that because it was a question that was raised in the media, and the answer that was given included a whole lot of words, but did not answer the question. And I think one of the things we do in Trinidad and Tobago is accept that the way it is the way it has to be. And the reality is we already have the laws in Trinidad and Tobago to allow us to have a higher level of emergency response service if that is needed. So it is something that we can think about. It is something that we can look towards, and it's something that can help us with one of the complaints that we get all the time. That is why the media personality asked the question. And what he said is, can't we get, I'm paraphrasing, can't we get an ambulance service in essence that is more than just a ride to the hospital? Because that is the perception that is out there. And when it comes to many of these things, perception is reality. And we have to be conscious that that is what's happening out there. As I said, Madam Presiding Officer, the family who has the leaking roof and the electrical issue cannot and will not, unless those things are fixed first, be excited about a swimming pool and a guest room. I will close, Madam Presiding Officer, by reading one final quote. And this person made the comment publicly about the motion, about the proceedings, about the healthcare system, and so forth. And I quote, the person said, "I will not be tuning in either. When tetanus shots, immunization cards, and gauze start running freely in Tobago again, I will listen to the goodly lady. Until then, she is like a worthless man doing everything else but sing about his family, but boasting about how good a provider he is." Thank you, Madam Presiding Officer.
Leader of Assembly Business.
Thank you, Madam Presiding Officer, but this time I defer to the goodly member, Councillor Dr. Agatha Carrington.
Is this a wrapping up session? So you're wrapping up?
Thank you, Madam Presiding Officer. I would want to thank my colleague who contributed to the support of this motion. I also want to, as I do that, I want to specifically draw on and refer to those areas mentioned by the minority councillor and by the assemblyman. My expectation is that data will drive our commentary, and that is for all of us, not just for those on this side. So whether it be qualitative or quantitative, we still want it. I am not in a position to use comparisons that are not the jargon in the health sector. So I can't really point to the issues with respect to worthless men and so on. I won't bring that indignity to the House because I have not had that experience. I would want to ask those on the other side to leave our dedicated staff out of mischief. Much of the commentary seemed to be centered on divisiveness and interference with respect to the work of our dedicated staff. Yes, there have been challenges, but let me just go through all of these parts. And I'm starting from the end back up, and I'm referring to some of the issues raised. So the emergency medical system and the opposition and the minority interface with those persons, many of whom still need to be trained up. My answer could not have been direct because we did not, and we inherited a head who is a carpenter. And we have to shape a carpenter into an emergency health service professional. And we are in the process of doing that. So it is a work in progress. So my conversation around and the fact that it is felt that I didn't say what you wanted me to say, I would ask to leave our dedicated staff out of your mischief. What are these instances in which persons have had to suffer, as you have said? My expectation is that we will have the data. And yes, we will want to train up our staff, and we will do that because we inherit a cohort that requires training. So I would not expect, or no one would expect me to say that if something critical happens, that they could intervene. They're not there yet, and that is a work in progress. The discussions around whether or not we have neglect of primary care, we inherited projects $2 million and up. We inherited ivory towers. We had to dismantle those. And all of the conversation, we know where it came from because we hear it all the time. I interface with these persons, and we said, we can't do it in that way. The investment that you are asking for or you have been benefiting from cannot be sustained. Again, just leave. Don't drag them into mischief. Don't pick at them. We understand the value that we place on health promotion and disease prevention, and we will continue to do that. So whether it is felt that in our primary care centers, people speak about many things, and it is commented on as though little is happening, and when we speak about the numbers, people point to the numbers as though they don't mean anything. If you didn't know what happens in a lifestyle clinic, please say. Our lifestyle clinic is allowing us, and we are encouraging persons to come, so we teach them how they can accept greater responsibility for their health. So more people are coming to be educated as to. So the numbers are important. The fact that there's greater access, they come. They do not continue coming after they are coming. We teach them how to do better. These issues with respect to what is in people's private inbox is not for here. That is private. But the conversation around the needs of Roxborough, that is important. Roxborough is underserved, and that's why we are dealing with it. But one cannot say that because there are issues in Scarborough, the people of Roxborough are not entitled to a secondary care facility. And it is not true to say that we do not have adequate staff. Again, the data will show. So if you're saying we don't have adequate staff, what categories? Break it down. We have upwards of 330 RNs at Scarborough Hospital. It's unheard of for a hospital that size. But you are saying we don't have adequate staff. What is adequate? How many more do you require? And so we would want to hear that. In imaging, how many do we have? Much more than we require. So don't be saying we don't have this and we don't have that. We do have some gaps, but it is not as you are describing. What is adequate? So this theme that is running through about not having the staff, that needs to be looked at. maybe the source of your information needs to be checked. The issue with respect to maintenance, yes, that is a vexing problem. And so this facility is 12 years plus. And yes, we should have better maintenance arrangement. But again, this is a work in progress. We inherited persons and systems that are inadequate. We have staff who need to be trained, and we rely on persons to help us. The issues of whether people come from Trinidad or whatnot. This is a Trinidad and Tobago. It is not just a Tobago. And so this concern about people coming, we don't have these skills. We don't have all of them. So they could come from anywhere. And your colleague mentioned that we look for where the skills are. So when we bring a team of professionals to intervene, we don't have a neurosurgeon. Are you going to let a house officer intervene if you don't have a real neurosurgeon? You have to get the skills from where they come, where they should come. I am listening to all these issues about experiences. I was waiting for the councillor's own experience, because I have had experiences at the hospital. My family have had experiences. But I was waiting to hear yours. I am certain that you will not say all these negative things that you are saying. Yes? I am also waiting for you to point to your interface with the division and the fact that we, in the face of all our challenges, will accommodate each and any request that you will make. And so that is the business that we are in. We are not into saying only things that are negative. Whatever happens on this island, we are in this together. So it's not who is on the minority and whatnot. When we are ill, that same Scarborough General Hospital that you criticize, you are going to need it. So all the issues around good outcome and what and whether or not people's interactions have been this way and what metric is used, I want you to use your own metric in terms of your own interface with the system. Don't ask anybody else. Tell us your own. Don't ask anybody else. And let us see the extent to which this system was one that you felt confident enough and was safe enough to use it, whether it was client-centered enough, whether there's equity, because on each and every encounter, what did you experience? Who are the people you've been talking to? You weren't talking to the mischief makers. You were talking to professionals who are interested and who are professional enough to intervene and take care of each and every client, not your mischief makers who inbox you. Indeed. And all the issues around, you baffled. You always baffled. Let us deal with the thing. You always baffled, man. You're a professional. Stop being baffled. And you think that we are saying this service requires attention, yes. But you had nothing good to say. You have nothing good to say. All the quality, everything is not thing until you say shoe horse instead of horseshoe and shoe and all kinds of things. What is good quality? We are coming to do a motion and we don't know what services we have. We have 17 primary care centers that are at different levels. We don't even know that. We need to understand exactly what we have. And so the conversation around the renal disease clinic, we are not going to have a professional whose qualification is questionable head up that service. So when you're talking to them, tell them that the reason why that person or that service is as it is because we are seeking to get an appropriate professional who is qualified to do what we want them to do. So it's not because we think and you all were doing this and that before. When we speak about whatever you and they, right. I was waiting for this definition because it seems as though we come to school when we come here. This matter of the definition of quality still requires definition. Just as how you were saying that I didn't answer the wannabe reporter or whoever, whatever name that person could be called. In like manner, I am waiting for you to define this thing because you're saying quality is this and that.
Councillor,
and wrong.
I can appreciate your passion, but can you direct your responses through the chair?
Yes. Yes, I apologize, Madam Presiding Officer. So this issue of quality, Madam Presiding Officer, still requires definition. So whether or not we are meeting the customer's expectation, that is a question that the minority councillor and this population will have to address. All the issues with respect to whether or not we are duplicating or whether we are doing this and that, we look forward to persons like yourself, Madam Presiding Officer, who seem to have all the knowledge and the experience to come on board and assist. Because as I'm saying, we are in this together. We look forward to you working with us. You have worked with us before, Madam Presiding Officer, and we look forward to that again. We will be, Madam Presiding Officer, advertising for certain positions, and I feel certain that the minority councillor will be an eligible person to apply. We look forward to that. As I said, we treat with all our professionals. We treat with all of them. Just looking at the experiences of our partner there on the other side, he seemed to think that we are rushing decentralization, but if I recall, this process has been in train quite some time ago. Even with the advent of the regional health authorities, the policy was one of decentralization. And indeed, we have, Madam Presiding Officer, these primary care centers, a network of them, and a Scarborough General Hospital. So we are not rushing anything. We are seeking to implement a policy that has been agreed to years ago that has not been successfully done. I understand the discussion, Madam Presiding Officer, around greater resources, but I also know that the issues with respect to using our resources in the best way is something for us to look at. The conversation around whether or not the population is or has confidence in the service, let the population decide. They still go. Some have had bad experiences, and then we would like to sample because we will want to know exactly, because I do that all the time. I go to the hospital, I gather data, and I would like to compare the data on both sides so that we could reconcile what is being said. For the gaps in service that he said that he experienced, in every service, Madam Presiding Officer, there will be gaps. And the effort is to continue to improve on those gaps. And as we continue to work on behalf of this population, we will ensure that we close those gaps. With respect to the facilities and services that, and I'm sure, and I commended the staff for the interface they had with him and with others. I certainly want to thank them again because, and as he supported as well, he had a good experience, but I do not think it was because of who he was. There are many persons who, notwithstanding their station in life, have had positive experiences. We understand that we need to look at quality, efficiency, acceptability, and equity. We know that. And we are building out a service that will do just that. That in the case of equity, on each encounter, you have an acceptable one. That in terms of the quality of service that we look at, and there are issues with respect to that, and quality is definable, because the challenge we would have is the extent to which we have the appropriate inputs and the efficiency in the processes to give us the quality outcomes. And I did not for a moment mention that I can measure the outcome as yet. I didn't say so. With respect to the fact that we do not have these resources and the discussions, Madam Presiding Officer, about the issue of reagents, I just want to put on record that the suppliers for reagents, they have been having challenges with their foreign exchange. And even when we pay our bill to them, they are still unable to provide the quantities that we require. But yet the conversation is around not having it. We cannot import ourselves, and we rely on them to do so. We have had previous challenges in terms of meeting our commitments, or financial commitment to them. And we have closed that gap significantly, and yet they cannot procure. Their challenge is obtaining the foreign exchange to purchase the items we require. And I want the record to show that. In terms of not having bed sheets and all of that, Madam Presiding Officer, we deal with facts. We've provided 5 sets per bed at hospital. And so somebody saying no bed sheets is hard to think. I try to be very intimate with the service delivery, and that cannot be substantiated. I am also not aware, Madam Presiding Officer, that there's any reduction in the budget for lab. I am not aware of that, because that is not the reason for which the reagents at this time cannot be provided. Yes, we have challenges with the incinerator, and I'm pleased to say that we are replacing the incinerator with a more improved technology, I must say. So we're moving to a microwave type of incinerator, thereby reducing the challenges we have in terms of the community complaining about the emissions, reducing the number of breakdowns that we have, ensuring that we can correct that situation. So we have not been sitting idle. The other area I want to point to is that of not having an ethics committee and all of that. There is an ethics committee. The ethics committee will meet and ought to be meeting every month with respect to determining those persons who should have renal disease management. I thought the discussion was around how could we work together to reduce those numbers. There are 14 on the waiting list, 14 of them. We just do not have the capability to do so many at this time, and therefore we are looking towards how we could expand that service while at the same time deal with the primary care piece of it. The ethics committee determines whether you have PD or you have your hemodialysis. We have trained persons to use the PD, however, they seem to prefer not doing so, complaints about not having the kind of support, and therefore, by waiting, they end up having to wait for a chair. May I say that just 2 days ago, we got a chair because somebody died. That is our reality. So this ethics committee, when they meet, and they have met, they met on Wednesday, they will determine whether or not you get service. But the crux of the matter is the discussion is not around that. We ought to try to see how we can get persons to stay away from those chairs, Madam Presiding Officer. And to the decentralized clinic for renal, we look forward to hiring an appropriately medical board approved professional to interface with our clients. We cannot do it with anybody else. The same people will sue us if we do that. With respect to the situation in the pharmacy and the fact that the pharmacist leaves early, I don't know that the Secretary for Health could fix that from where she sits, but I will encourage the CEO and team to look at the extent to which they provide much more client-centered service, and that the service is extended up to the time that they are scheduled to work. With respect to the services for cancer care, I don't know we have the responsibility for that. We have given to the Family Planning Association about 20-odd years ago a space for them to use, and we continue to partner with them. The fact that it is overrun by any environmental issue, I could only apologize, because it is not our responsibility. Madam Presiding Officer, the issues with respect to the availability of drugs at hospital and at every hospital in Trinidad and Tobago, in the Caribbean, and any other place, you will find that happening. That is not to say we will not try to deal with these matters. So whether it be liquid Panadol or IV Gravol or whatnot, we will deal with those if indeed it is so. I have witnessed already, Madam Presiding Officer, where an item is not available in one clinic, but available in another. We have to look at what resources we have across the board and try to access whatever we need to have from there. With respect to the duplication of services, I mentioned that before, but the commentary with respect to whether or not the building is, the old hospital has been decommissioned, let me comfort or provide comfort to you by saying that we have taken the pains to do many things, to carbolize the building, to use all the various chemicals, because we know what happens in a healthcare environment. So it is not associated just to that environment. Even the one we work in, the one that we go to, also has pathogens. And so we understand that. And we are not careless to have anybody go in a building that has not been properly prepared for use. So again, could you check your facts, because it so happens that what is being said, it is not correct. Again, we encourage you to work with us. If you want to share your expertise, come on board and work with us, so together we will change the system. Together we will improve service delivery, because even if one has an air ambulance, Madam Presiding Officer, they still need to be stabilized on the ground here on this island. We all need this service. Madam Presiding Officer, and to my colleagues on the, my own colleagues, we have attempted to deliver within our budget many areas. We have committed to and have been working on decentralizing service delivery. We have committed to and have delivered.
Secretary, Leader of Assembly Business.
Thank you, Madam Presiding Officer. I beg to move that we continue with the debate until we've disposed of all the business on the order paper.
Members, the question is that we continue the debate until we dispose of all the business on the order paper. All in favor? Any against? Secretary, you have 4 minutes.
Thank you very much. We have established a stroke and diabetes center. We've established a foot and ankle center. We've also moved ahead and established an NCD registry and started populating that, as well as a stroke and cancer registry. We've continued to collaborate with the Family Planning Association in the provision of sexual and reproductive health. We've trained our nurses in specialized areas. We've provided support for medical interventions that are not available on the island. We have equipped our public health fleet with a fleet of 10 new vehicles. We've upgraded our solid waste facility. But what are we going to be doing as we go forward? Several things. Just quickly, we've not left our children behind, and we look forward to establishing our own children's lab. I said earlier that we have a facility for children at risk, and we will continue to build on that. As we go forward, our Moriah Health Center, that has already started, will be completed by April 2020. We've turned the sod and have started our Roxborough Hospital. We expect to deliver that in July of 2020. We will continue on initiatives such that our population will be served. Our renal disease clinic that continues to be challenged, that area is to be expanded in the coming year. Indeed, as well, we're looking at our public health laboratory to have it upgraded. We will continue providing all the services that are required for our population. Finally, in terms of our laboratory equipment, we have invested in and will soon have delivered to us much needed laboratory equipment. With respect to our postgraduate training, we expect to have postgraduate training of our doctors commencing in January at Scarborough General. We expect as well to have our Healing Garden launched as we seek to address mental health. With respect to our men and adolescents, we will provide that service as well within the coming year. Madam Presiding Officer, I thank you for this opportunity to table this, or to discuss this motion. We believe that the work we have done will significantly contribute to improving service delivery for our population. We will continue to build on that. We will continue our collaboration with other stakeholders such that we impact this population. I thank you very much.
Members, the motion being put, whereas one of the fundamental pillars upon which any society develops is an effective healthcare system, and whereas this administration, through the Division of Health, Wellness, and Family Development, has been leveraging the decentralization of and improvement of healthcare in Tobago, be it resolved that this House take note of the initiatives that have been implemented in improving the delivery of effective healthcare on the island, and be it further resolved that this House encourage the Tobago population to access these newly decentralized services and continue to participate in the community engagement exercises of the division. All in favor? Aye. Any against? Any abstaining? The ayes have it. The motion is carried. Leader of Assembly business.
Thank you, Madam Presiding Officer. I beg to move that this House now stand adjourned to a date to be fixed.
Members, I wish to make a statement prior to the adjourning of the House. Today is the 30th sitting, and it is the last time that Mrs. Sharon Irvin Cumby will sit as clerk of the House. She leaves us shortly on pre-retirement leave, and therefore I wanted to commend and thank her for her service. In the 30 sittings to date, she has missed one, the first budget statement. And that was because I requested her to represent the legislature at a regional meeting. In 2017, 3 weeks after I was installed, Mrs. Cumbly replaced Mrs. Delancey, and she must be commended alongside her staff for executing the priority projects and new initiatives she was given. She has overseen at least 3 training sessions for constituency officers, arranged trainings for you, the members around the table, and many other trainings for staff both on site and at Parliament in Trinidad. As clerk, she also executed the installment of a new intercom system in the House, which we thought we would have to suspend a sit-in for at some time. She also executed the modernization of the operations of the House and its visibility through the use of social media and the launch of our website. Further increasing public awareness through programs like A Night of Mystery and my first speech competition, which was rolled out to primary, secondary students and also adults. She had staff trained so that we could accommodate a significant increase in tours to the legislature. And of course, oversaw the implementation of the new logo for the Assembly legislature. We just completed and laid the standing orders for this session, and for the first time, it's not distributed by paper, but will be electronically accessible on the website. Of course, the elimination of single-use bottles, which started today, and replacement with coolers. Beginning the repairs of the clock. The clock was long overdue, and she was able to begin those repairs. The rest of the parts are on their way from the United Kingdom, and unfortunately did not get here for this sitting, so she could close it out, but hopefully by the next sitting we could celebrate on that. And of course, moving to a paperless house, I would have mentioned that the laptops are in the procurement stage, and very soon you would have your order papers on your laptops and also your standing orders and any other items we have to distribute to you. The signage program throughout constituencies in keeping with parliamentary standards is underway, and of course ongoing of the refurbishment of the well-needed cast building to accommodate the expansion of the legislature. I could go on and on, but I think you got the point. That she must be commended for her work at the legislature and overall for her service given to the Tobago House of Assembly. Clerk Cumbly, on my own behalf and that of the members of the House and your colleagues who are here to support you today and all of Tobago, I say thank you and wish you the best in the future. I would like you to give her a good desk mark. Members, the question put is that we adjourn this House for until the next sitting for a date to be announced. All in favor? Aye. Any against? The House is now adjourned for a date to be fixed.